Are you ready to unmute your power? Are you sick and tired of being told to shut up? Welcome to Something to Say with me, Jamie Shae, because silence is no longer an option. This is not just a podcast, it's a revolution. This is for the women who are done tolerating mediocrity, done biting their tongues, and done playing small. With bold truths and unfiltered insights, I'll help you rip off that proverbial muzzle, put your stake in the ground, and take back the power you were told to suppress. You were never meant to be silent. The world is waiting to hear your voice. It's time to speak up, and speaking up starts now. Welcome back to Something to Say, the show where silenced voices rise, truth becomes power, and healing begins with expression. I'm Jamie Shae, and in today's episode, it's especially close to my heart because I am joined by someone who came from me, and I can feel her cringing at the statement as I say that, but who also has taught me as much, if not more, than I've taught her. Dr. Kayla Calhoun is a chiropractor, a successful business owner, and a natural born healer. She's also my firstborn. Kayla works with patients every single day who are carrying more than just physical pain. They're often carrying stories, trauma, and emotions that have never had a voice. I believe that pain is a messenger, that when we silence our truth, suppress our emotions, or disconnect from our bodies, it shows up as tension, inflammation, and suffering, dis-ease. So today we're going to explore the connection between pain and power, between the body and the voice, between silence and healing. We'll talk about how the body remembers what we try to forget, how healing happens when we begin to listen, not to others, but to ourselves. So whether you're someone who's been living with chronic pain, emotional scars, or just a quiet knowing that something inside needs to be heard, this conversation is for you. So let's go. Hi, baby girl.
Hi.
Sorry for that cringy thing. I had
That was so cringy.
Well, welcome to me. Thank you for being here. So let's start with an easy one. How would you describe your approach to healing and what makes it different than like a traditional medical model?
I think chiropractic in general is a little bit more of a Eastern medicine as opposed to Western medicine approach as a concept, just because we're not prescribing anything, we're not doing surgeries, we're not doing invasive procedures. It's all very working from the outside in, as like physically. And so I would say a lot of it is, the patient and the chiropractor working together to figure out what works and what doesn't. I always tell people that it's a lot of trial and error. It's not like you walk in and I do the same thing on every person, because everybody is going to respond differently. So what I think is going to work is what I'll try, but if it doesn't work, or if it's uncomfortable, or if you just prefer something different, then there's other ways to do it. And I think that's the biggest difference, is that a lot of things are not approached as you have this illness, there's this treatment for it, or you have this diagnosis, and so we're going to give you this prescription for it and just hope that it works.
Yeah.
We do a lot more kind of like experimental, working together and kind of seeing how your body responds to things, because that's going to be super different from somebody that has the same type of pain coming
Yeah.
in with a different lifestyle or a different job or a different history of surgeries, or so
Yeah.
and also we see people more frequently for that same reason, because I usually tell people to come back a week later, because it kind of gives them the chance to see how things are feeling differently, and then change it a week later if we need to do something differently.
Yeah.
Or if they feel good, then they feel good. Then we go forward with that treatment.
Awesome. In your bio, you mentioned that like 70% of your patients deal with chronic pain or autoimmune disorders, things like that. do you find that patients with these conditions often carry emotional burdens or like unresolved issues or stories? Do they talk to you about that, or does it come out in some way during your
Yeah, yeah. I don't usually directly ask,
yeah.
like, do you have medical trauma or like, do you have emotional stuff that's behind this? But
Mhm.
usually as they get comfortable with me, patients will kind of open up to me a little bit about that. The most common thing I see is like people with chronic pain that has been there for a really long time. If they haven't been to a chiropractor before, a lot of my patients have never been to a chiropractor before because they've tried everything else, because it's been there for so long.
Mhm.
And, chiropractic isn't always the first thing that people think of. It's not as common, I would say, to go to a chiropractor, as it is to like go to urgent care or go to your primary or, get an x-ray. But once people get to that point, even if they haven't been to a chiropractor, even if they don't know anybody who's been to a chiropractor, at some point they get there and they come and see me and they will let me know like kind of what they've been through to get to see me, like all the different specialists they've seen, all the different like tests they've done and the diagnoses that they thought they had that they had to rule out, or they, all the symptoms that have changed over time or not changed over time. And so a lot of it comes out in that conversation, especially if they have some kind of medical trauma related to that, because it is traumatic to have pain for 5+ years and nobody knows what's wrong with you and nobody can help you. And you've spent so much money and time looking for answers. And it comes down to like, we don't know. That
Yeah.
that is traumatic because that's when a patient feels completely unheard and, unvalidated. And
Yeah.
so that's where, when they get to me, where the conversation changes into like, what have we been dealing with that maybe is making this whole thing worse for you and more emotional for you.
Yeah. And I'm a big believer in there's a connection to not being believed. And a lot of women aren't believed when we speak our truth or when we say we have certain pains in our body and it's dismissed. I think that is trauma and that is suppression. Like we're suppressing deep rage around that.
Mhm.
So do you feel like, do you see how once you start giving patients a space to talk about some emotional trauma, medical trauma or otherwise, that they start to heal?
I do think it opens up that possibility. Just, I mean, it was not something I consciously did, like going into practice being like, I'm gonna have this conversation with people, for this, because I honestly didn't even know how common it was for people to be so invalidated by the medical system and even by other chiropractors and, like other types of holistic practitioners, like they can still have that bias against certain conditions or certain types of people, or even men versus women dealing with pain differently. And I think I didn't realize how prevalent it actually was, even though I knew it was a thing.
Yeah.
So when I started in practice and I started getting the feedback from patients that nobody's ever asked me that question before, or like even just like the first appointment, I always say, like, have you been adjusted before? And if you have, is there a way that you prefer for that to go? Because there's more gentle ways, there's more manual ways. And I'm like, do you have a preference? Like, or do you not care? Or do you want me to like, just do whatever I want to do? Or do you want me to stick to the more gentle stuff? And people are like, I've never been asked that before. Like I've always walked into a chiropractor's office and just been told what's going to happen,
Yeah.
and like not feeling like you have agency in your own health is a huge part of also why things don't get better. Because like part of why things do start to heal physically is the patient paying attention to their own body, figuring out what doesn't work, figuring out what causes pain, figuring out if, movement is helpful, what movements and how often, and do I need to join a water aerobics class for like less impact on my joints, or do I need to start running again, or like like they kind of start paying attention to their own habits in their own life,
Mhm.
and they figure out what works for them.
Yeah.
And like that's my job, is to like help them in that transit. It's not come and see me once a week forever. It's like the transition from seeing me and having me be the driver of your health into you being the driver of your health. I'll
Yeah.
I'll just help you find the right answers, like the things that have helped historically.
Do you have more women or more men, or is it pretty even?
I would say it's honestly pretty even. I have a pretty good
Yeah.
split of men to women. I would say like of the chronic pain sufferers though, it's definitely more women. Like I would say like the more honestly, I don't know if that's because they're more comfortable with me. And so they come and see me for their chronic pain because I'm a woman, or if it's because the men aren't telling me or what. But I definitely, the trend is that all of the, especially autoimmune conditions and all of the like, fibromyalgia, the all that stuff that's just, or birth trauma, like
Yeah.
all a lot of the women in my practice have something chronic, or something that hasn't gotten better.
Yeah. And I'm going to just be my spiritual self here and say that I believe that is connected directly to silence, being silenced, having your power taken away or giving it away. And that is how the body deals with it. And that's why it's so hard to diagnose what's wrong, right? Fibromyalgia seems to be like this diagnosis for we don't know what's wrong, but we believe you have pain.
Mhm.
And so it's kind of a generalized, that's what I'm not, obviously not a medical person, but I
It's
feel
a
like
diagnosis of exclusion for sure. Like you have to rule out everything else. And once you haven't found any, physical thing that's causing pain, and
yeah,
fibromyalgia is there's pain everywhere. Like it's not
yeah.
just like one spot. It's, I have pain and I don't know why, and nobody knows why.
And nobody
And
knows
so
why.
they get to that diagnosis by basically saying we haven't found any other reason for it.
Yeah. Do you notice a difference in how men advocate for their own health versus how women advocate for their own health?
Yeah, I would say more commonly when a man, especially, in that instance where they've tried everything else, um, I would say men are much more direct in what they're, like they'll go to a doctor and they'll say, I want to be tested for this, or, like I think I have this, like test me for it.
Mhm.
Or they'll go, or honestly, that sometimes they don't even need to do that. They go to urgent care and they say, I have pain here. And the doctor might just say, okay, well, we'll just send you for this imaging, or we'll give you this prescription. And it's less of a fight, it seems, at least from what I've heard from my patients. I've
Yeah,
never been there doing it, but yeah, it just seems like less of a battle. Um,
because
and every time I recommend going to get imaging, or I recommend somebody go to the ER, they never come back and tell me that nobody believed them. Like the men never come back and say, I did go to the ER. They told me there's nothing wrong. Like, or, they'll say, I went to the ER, they did this and this test, and I have this surgery scheduled. It's like,
right.
I've had a lot of cases where I've told somebody to go to the ER for a very serious reason, and they'll come back and tell me that nobody believed them. Like they didn't think anything was wrong, and they were rude to them about it, and they sent them on their way. And it's just it's too bad that that still happens, but
Yeah,
it has happened,
yeah.
and I've
And
heard it quite a bit.
it's beyond medical issues. It's
Yeah.
being believed, and it's going to be a topic for a future show because it's so huge, and I do believe it's directly related to chronic pain or anxiety or lots of medical issues
Mhm.
that we then tend to go get pills for to numb, but really our bodies are messenger, and there's messages in that, in the pain, whatever the pain is. um what do you wish more women knew about their bodies and the pain that they have?
I think I really wish uh more women knew that it's okay to tell the doctor what you think is wrong. Like, like they're not gonna, they might, maybe they might judge you for, WebMDing it or, Dr. Google, but at the end of the day, you have a question. Your symptoms have matched up what you found here, and you want to rule it out. It's not necessarily I want you to diagnose me with this thing, but I want to know if I have this thing.
Yeah.
And so please help me figure that out. You can't always do it yourself. So it's it's okay to ask for what you want. It's okay to ask the doctor for what you need to feel okay medically, to know that you don't have breast cancer or to know that you don't have a tumor in your spine. Like
Yeah.
whether or not it sounds dramatic to do that. If your symptoms match up with this thing, they should be ruling it out anyway. That's standard of care. And
Yeah.
if they're not, if they're assuming that, I don't think there's anything wrong here, but they haven't done any imaging or haven't done any blood work, that assumption is based on nothing except their own clinical bias. So
Right.
it's okay to push for that. And if they still refuse to give you an X-ray, an MRI, blood work, have them document it. Have them say in the note in their chart that you asked for this thing and they refuse to give it to you. Suddenly, they will give you the thing that you're asking for. Like, and I wish more people in general knew that. And I've had that conversation so many times in clinic where I'm like, they'll tell me this experience in the urgent care or in the ER, and I'll be like, "Y- do you real like did you ask for that? Like, or did you like tell them what you're thinking is wrong, what we've been talking about?" And they'll be like, no, I just told them like what I've been feeling. I'm like, I hate that you have to do that, but you have to advocate for yourself. Like you have to.
Yes.
Nobody else is going to do that.
Right.
It
And
has to come from you.
yeah, and I love what you're saying, and I would add to that, even if you have them document and they go ahead and do the testing, find a new doctor. Find
Yeah.
find a new one
It's
after that.
that's the other thing that it's okay to do. It's
Yeah.
okay to get a new doctor. It's okay to doctor
Yes.
shop a little bit. Like I wouldn't say like doctor shop until somebody gives you the drugs that you want, but it's like
No.
it's
No.
okay to look for a doctor that you feel is listening to you. Like,
Yes.
because
Yes.
not all of them will. Like there's a lot
Yeah.
of hospitals or medical systems that are really overloaded, especially right now, that you only get 2 minutes with that doctor. And, you can get a vibe off of that doctor in 2 minutes, whether or not they are hearing what you're saying and responding to you in a respectful manner.
Yeah.
And, whether or not they think you're being dramatic, they should still respect your autonomy and your medical autonomy to say,
Yeah.
I want to know what's wrong with my body, if anything,
Yep.
and they should respect that request. It's, yes, you have to go through some insurance battles a lot of the times to do that, but they are the drivers of that, not you. Like the doctor is the one that gets that process started. And if they won't hear you in the first place, you'll never get there. So
Yeah.
get a new doctor.
Yeah. And and that's true in the mental health and field as well.
Yeah,
I know I doctor shopped. I didn't call it that, but that's perfect. That's exactly what I did. But I went until I found somebody I felt got me, which is
yeah.
no easy task, I will say. So I mean, I saw, but I give them one or two chances, and that's it. And so if somebody's not listening to you, stand up for yourself and go find somebody who will listen to you. That's the kind of power I want women to remember they have. You do not have to accept a doctor not believing you or allowing you to suffer.
Hmm.
That's that is,
Yeah.
you have to stand up for yourself. You have to say that's not okay with me.
Yeah.
How,
And this
how do
this
you,
is true for medical doctors or for medical doctors and for non-medical doctors. Like it's okay to find a new dentist if the one that
yeah,
you've been working with hurts you, like, or doesn't listen to you when you say that you're not totally numb yet. It's like,
yeah,
or it's okay to find a new chiropractor if the one that you're using isn't gentle enough for you or isn't listening to you or you don't like how they do things or how they talk about you. Like it's okay to like in general, it's okay
right.
if you want to form your medical team, especially if we're talking about chronic pain, especially if we're talking about things that like don't always have a straightforward answer. You want a medical team around you that knows what you're dealing with and like hears you and validates that and is wanting to help you instead of, maybe motivated by, wanting to get to the next person or, wanting to finish their day. It's like,
Yeah.
and some patients and doctors just don't mesh for other reasons too, just personality wise. But it's totally okay to find a team that you feel comfortable with.
Yeah, and a lot of times there's that generational pressure to like, this has been our family doctor forever, or this is, and you stay with that. This is a little broader than that, but what have you learned from me or from our lineage about voice, silence, strength? What have you learned along your journey of becoming a doctor? And
I think that I think in general, I've learned because I think when I started out in practice, I was a lot more reserved when it comes to advocation and, kind of having strong opinions about this sort of thing. But the more people I talk to about it, the more I've, learned medically that I can relate back to like, my grandma or you or, like health issues that you've had before or like, stories that I've heard from, years ago, how things were dealt with medically. It's like, like I learned how important it is to not only advocate for yourself, but also to encourage other people to verbalize like it is okay to stand up for yourself. Like it is okay to do that. Nobody's gonna like nobody's gonna judge you for doing what you need to do to feel better.
well, if they do judge you, that's
Yeah.
that.
They won't tell you that they're judging you. So
But
it's
if
like,
they do, they're not the right person. Maybe they're not in the right field at all. I mean, there's always,
yeah,
you know,
there's always that. Yeah.
yeah,
But
but
yeah, I think it's just
but
the
it shouldn't
important.
stop you.
Exactly. Yeah.
Yeah.
And I think it's just the importance of encouraging other people to like I might know how things work in the insurance network or the medical system, but like not everybody does. So like for me to verbalize that to people, I've gotten way more response from people to be like, I didn't know that, or like I haven't thought about that, and it's like I think, learning that stuff and then sharing that knowledge with other people is how everybody gets better, because, as much as there are some like pre-existing systems in the medical system that are very outdated and like, they don't always treat everybody well. Not everybody feels heard and not
Yep.
everybody feels treated or not everybody feels taken care of. I think if we can learn from past mistakes in the medical system, if we can learn from like physical therapist horror stories or or
Yeah.
surgery horror stories or then we can pass that knowledge on and
Yeah.
say we need to do better
Right.
as a doctor. I need to do better to tell people what how to support themselves. And so that's what I try to do is to support other people in their own health journey.
Hmm.
And because I know of all these horror stories, because I know of all this mistreatment and malpractice that has happened
Right.
previously.
Right. So, like I said earlier, I believe pain is a messenger and it's our body trying to tell us something. So this is my favorite question. If and I know this is gonna like vary, but I'm just curious what you think. If pain could speak, what do you think it would say?
I think I think pain is our body's way of, it's our brain's way of understanding that there's something wrong in the body. It's like pain is just the signal that we get in our brain that says there's an injury somewhere.
Yeah.
There is a tissue or a bone or, a nerve that's being being irritated in a way that's not supposed to be there. And it's your body's response to it that tends to be what causes more pain, actually. But so I think if pain in general could speak, pain is saying, I need to protect something. Like there's something to be protected here. There's a trauma in the body that we all need to rally around. All the blood cells, all the muscles, all the ligaments need to get stronger here and support here, um, because there's something wrong here. It kind of makes this little cocoon around like the spot that is causing the signal. And a
Yeah.
lot of times actually there is no thing that causes this. We don't know enough about pain science yet. There's a lot of like research being done around it about like why are we getting signals from things where there's no structural damage. But there is a lot of instances where there's nothing physically, there's no tear, there's no injury, there's no disc there, but there's pain coming from there, and the
Mhm.
body rallies around it. And so I
Yeah.
think it's basically like a smoke signal that says, I need
Yeah.
help. Like something needs supporting here. And so the
Mm.
body responds to it.
That's amazing. Kayla, thank you so much for joining me in my mission to help women find their voice and reclaim their power. You are amazing. I'm in awe of you. Your perspective and insight is incredible. So if anybody lives near Hillsboro, Oregon, be sure to book some time with Kayla. Kayla, what's your website?
Steppingstoneschiro.com.
Amazing. Pain has a voice. Today we honored it. We explored the truth that healing doesn't begin at the surface, it begins in the silence. And the things we've held in, the stories we never told, and the grief we've tucked away in the tissues of our bodies. The body remembers and it has something to say. So, thank you all very much for listening. And I wish you all health and happiness. And we'll see you next time. You've been listening to Something to Say with me, Jamie Shae, because silence is no longer an option. Catch me live every first and third Wednesday, 10 a.m. Pacific, on transformationtalkradio.com to learn how you too can rip off your proverbial muzzle. Silence was never your destiny. It's time to speak up. Subscribe to my channel to listen first when new episodes drop. Follow me on social media and visit guidedbyjamie.com to join the community that has something to say.